Good afternoon and welcome everyone. Today we open our European series with a call on deinstitutionalisation is a global challenge. Whether we call it group homes, congregated care or community living, too many people are still denied real autonomy and the right to belong. So our focus today is person-centred, local, small supports approach that make dignity and choice real. Before we begin, please write your name, where you're joining from, and if you wish, your email in the chat. This webinar is organised and hosted by Social Protection Institute of the Republic of Slovenia and the National Development Team for Inclusion, NDTi for short. Just to remind you, this is being recorded and it will appear later on the Social Protection Institute of Republic of Slovenia and the National Development Team for Inclusion website, and a short report will follow. This is a shared space. We want your voices here, where all voices matter, especially those of experts by experience. And my name is Clinton Ferguson. I'm a trustee from the National Development Team for Inclusion in the UK, and I'll be one of your co-chairs for today roundtable. I'd like to invite my other co-chair, Stephen, to introduce himself. Over to you, Stephen.
Thank you so much, Clinton. Good morning, afternoon, evening to everyone. I understand we have people joining us from lots and lots of different parts of the world. It's a pleasure to be with you, Clinton, today for this event, and also to be with all of you to discuss the role of small supports in wider deinstitutionalization strategies. Very briefly, I'm the executive director of an organization called the Validity Foundation. We're based in Budapest, in Hungary, and work in Europe and Africa using legal strategies to promote the rights of people with disabilities. And so I'm really delighted to be with you all today. We're also joined by a fantastic panel who are going to help us kick off some of the discussions today. And so I'd like to invite each of them just very briefly also to introduce themselves one at a time. We have four fantastic panelists. The first one is Alexis. Could I invite you, Alexis, to introduce yourself?
Yeah, hi everybody. My name's Alexis Quinn. I was housed in institutions for about 4 years after a crisis. And I work at the Restraint Reduction Network and do lots of consultancy about getting people the right support in the community. Thank you.
Thank you so much for joining us today, Alexis. Next up, we have Ines. Can I give you the floor?
Yes, hi everyone. Thank you, Stephen. So my name is Ines Bulic-Kojokarius. You have my full name. I work for the European Network on Independent Living. We are a user-led European network of disabled people and their organizations. And we fight for everyone to have the right to live independently in the community with choice and control. And of course, we fight against any type of segregation of disabled people in Europe. So nice to be with you all today.
Thank you so much, Ines. And as I always say, every 2 years, the Freedom Drive in Brussels is one of the best events on independent living, so I love it. Thank you for joining us. Next, I'd like to invite over Milan to introduce himself.
Good afternoon. My name is Milan Šveřep. I am from Inclusion Europe, which is an organization that represents people with intellectual disabilities and their families. And I've been for a long time working to close institutions and replace them with a support for people to live in the community.
Thank you so much, Milan, for joining us today. And also, I'd like to give the floor to Thomas, who is also joining us.
Thank you very much, Stephen. I'm Thomas Bignell, Secretary General of the European Association of Service Providers for Persons with Disabilities. We bring together over 20,000 organizations who provide support to people with disabilities across 50 countries. And our mission is to help disability support organizations transform to be in line with the principles of the UN Convention. So our work is very much at the heart of this discussion. So I look forward to learning and exchanging with you on how to do this. Thank you.
Lovely. Thank you so much, Thomas, also for joining us, and to say that we have some incredible experience and knowledge, of course, in this virtual room, but also joined by all of you who are here today. And I hope we are hoping that this will be a really open and engaged discussion to share experience, to share practical actions that we are taking and can take, and perhaps also to stay in touch as we take some more actions coming out of this event. So with that brief intro, I'd like to hand back over to you, Clinton, to kick us into our first session.
Thank you, Stephen. This now we'll hear about small supports initiative in Slovenia and the UK. Andrea, I hope I'm pronouncing your name correctly, Andrea Rafgalic from the Social Protection Institute of the Republic of Slovenia will present to us now.
Yeah, hello to everyone also from my side. Yeah, we are also very grateful to be able to host this meeting together with NDTi. Even though I was given a very hard task to talk about small supports in Slovenia, which we still don't have, but we are very interested in this type of support and service. So we started our collaboration and getting into small supports a few years ago already. So we've been organizing already a webinar in 2024, and also we've taken several professionals from both institutions, mainly from institutions, to visit some services in the UK who provide small supports, and we've been there as well. So what I can say that in Slovenia, we have a developed technology on how to resettle people in smaller group homes, but what it's more like, I think what it's more promising is that we have quite a lot of now. Currently we're developing quite a lot of practices of individual resettlement of people from institutions to their own homes. But mainly, of course, people who with not people with most complex situations and needs, because it's been quite a challenge for us, both in terms of financing, of course, because it's such a small group of people with this very complex situation, and the policy is usually not oriented towards this complex situation. It's more important to have some sort of services for most people with support needs. And also because probably it's a challenge for everyone to develop a service. Of course, and another thing is that we are still at the beginning of the institutionalization. Hopeful we're starting it. Well, there's been several experiments, but we're now just starting it, and hopefully in the next few years it will progress quite quickly, especially since our government yesterday passed a law which basically legalizes community services, which before did not exist, but we still are waiting for the parliament. So next month we'll see what happened. But it's quite an important step forward. But even if this law will be passed, we still will not have a service that will be able to provide really small supports. I think it will be mostly, I hope we will be able to advocate for at least a small project, maybe for 2 people to start with most complex needs. We think it might be even children, because we had a scandal this year actually that because we created some places for children with very complex needs where they look like they're quite similar, use quite similar restraint methods and locked words as in locked words. So this could be an option, and we're hoping that somehow we'll start doing something. I think it's very important. We believe that it's very important to start on a small scale, to do it very rightly, correctly, and to prove it's possible. Why I think it is possible to develop such a service in Slovenia is because it's such a small country. So the absolute number of people who would need small support services is actually very small compared to other countries. So we're still quite a rich country, and I think we would be able to provide very intensive service, like more supports for us, for a certain number of people. Yeah, we, on the other hand, we also very strongly believe that as the Social Protection Institute, that also the people with most complex needs are a key point of deinstitutionalization. And that's why we decided also to host this event. We strongly believe that if we don't manage to resettle people with most complex needs, with people who have really difficult histories and so on, we will never be able to really be free of institutions. And hopefully we will not make the same mistakes as most countries did, that we left the people with most complex needs last. So for us, this event, it's not about sharing our experience, but it's more about the future and where we want to get. Thank you.
Thank you very much for a flavour of small supports initiative in Slovenia. Thank you for that. Can I now hand over to Nick Crosby from the National Development Team for Inclusion to do your presentation. Over to you, Nick. Thank you very much.
You're muted, Nick.
It had to happen, didn't it, Stephen? I'm going to share a screen in a minute with a couple of slides. I'm never a fan of slides, but there's so many different people online. It felt like a simple way of getting some key messages around small supports across to you. So hopefully this all works and everybody can see, and I can see everybody, well, as many as I need to. It's Mark, actually, on the front cover. Mark was supported to move out of an institution by one of the small supports organisations that we supported to set up in Leeds. Alongside Mark is Debbie, one of the commissioners in the local health services, who helped set up Mark in his new space. I'll come back to Mark in a minute, because but there is a video where Mark tells his own story on our webpage, and it's a really good listen. It's not long, it's only a couple of minutes. So I will put the slides up and we're off. So I'm talking about a programme of work that I've been involved in for the last 3 years, which is all about setting up new small support organisations across England. We've been working alongside the National Health Service in England to facilitate people who are in secure forensic inpatient services to be supported to move out, and that's in particular those people with intellectual disabilities, autistic people, people with enduring mental health support needs, many of whom have got physical support needs as well. So
Nick,
it's those,
just to say, sorry, I think your slides are not showing.
are they not?
Not right now, they were, but they went off.
Okay, well, I haven't got past the title slide, so that's okay. We will try again. Hopefully this time you're on. Yeah,
It is, yes.
excellent. Right, well, fingers crossed this will work. So the roots of small supports organisations, it's always useful to know that this isn't a fad or a new kind of thing that's come along that's the flavour of the month. This is a long-term piece of work that's grown from the closure of Lennox Castle institution on the outskirts of Glasgow in the early 2000s. If people want to know a detailed story of that closure process, there's an EASPD funded report and the links on the slides there. So when you get the slides, you can have a look at it. There's a number of examples of closure, but the Scotland example shines out as one of the most complete closure processes that we found during that piece of work. That's a picture of Lennox Castle as it is now. It's not been redeveloped, it's been left to fall down as it should be, and it's very much something of the past. But I think the importance was there that when they came to close Lennox Castle, there was a group of people who needed a lot more support than was available from the community organisations at the time. They had to set up a new organisation. The first one was Inclusion Glasgow. It said it would only support a certain number of people. It would stay small. It set up another organisation called Sea Change. Sea Change and others from that team are part of the team that delivers small supports at the moment in England. So we've got roots and they go back to actual closure of institutions, and they facilitated those with much more support needs to actually have a life in the community, as you'll hear about. What is a small support organisation? It's very simple, really. I mean, I started what the values and how it makes sense. It's about the person. It's about the person and their loved ones. It's about their life story. It's about what works for them. It's about what doesn't work. It's about what a good day could look like. Some of these questions people might recognize from person-centered planning, but it's very much about giving the person the voice and the chance to say, this is my life. This is how I need to be supported. Small supports organisations would turn around and say, the moment we compromise on this person's voice is the moment we'll begin to fail. And especially thinking about some people who've had horrendously traumatic experiences in institutions, moving out it might be a move of hope, but it might not be the easiest thing for them at the time. Then that compromise is never to be had. It's because the moment you don't listen to a person is the moment you'll start to fail. And I think that's consistent. It's all about relationships. So these relationships are about building relationships between the person who's going to be supported and those who are going to do the supporting. It's understanding that those relationships have to stand quite difficult times at times. But those relationships are the way that this support will continue to make. So we have support workers that have worked alongside people who've moved out of institutions, and they've worked alongside them for many, many years. And they've done that because they've developed a very caring, respectful, and mutual relationship. It's not about being unprofessional, but it's about understanding that those relationships are the most important things in human lives. And most of the people moving out of institutions, their life experience is one relationship after another being severed and cut, and quite a lot of those relationships not being particularly healthy anyway. It's about building connection. So this is about connection from when you're starting to recruit a team. So we would talk about matching, and people are sick of the joke I make about they all have to support Newcastle United, but it's all about finding a kind of mutual interest, passion, connection between people that's not about I can work these hours of a week or I need a job. It's about saying, actually, for this person, their most important thing is being able to find time to sit on the bank of a river and go fishing. And so actually the best thing to do is to support them with people who like fishing. If it's somebody who likes cycle riding, and I know that cycle riding is a big deal for one of the people, one of our small supports then it's a good idea to be able to ride a bike if you're in his support team. And that might sound daft, but actually it's not. You know, if people can cycle alongside each other or look after each other's bikes and repair punctures, they're immediately much safer because they have that kind of connection and that relationship. And the last part about it is it's about having a home of my own. So it's supported living. The home is not owned by the same people who provide the support. The home is the person's home. And if they want to sack the people who are working in that team, they can sack them, but they don't lose the home. I think within all of that, the notion of relationships is something we call stickability. Small supports organizations never walk away from somebody. It's not about, oh, things have got too difficult, we can't do it anymore. Because what sort of relationship does that mean? Does that suggest they have with that person? They are there to support that person, whatever's going on in their life. And I know many of the small support organizations that can lead to having some very difficult days, but they stick with that person and they never leave them. So there's some practical side. I've just restated the group that small supports has kind of grown up supporting. It's a commitment to staying small, you know, supporting 15 or 20 people and staying local. It's not about taking over national areas. It's not about big providers, because the moment you have a big provider is the moment that everybody in that organization doesn't know each other. And the moment people don't know each other, it's the moment when people aren't so safe. So it's a very simple thing. There's a very clear foundation of human rights. We structure a lot of what we do around Article 19, the right to live independently and to be included, because it's such a simple way of, it's my home, my support, and it's getting out and about in the community. There's a person-centered plan. That's very much the person's story. And with that comes personal funding, personal budgets, individual budgets. They're called different things. The importance is an individual sum of money tied to the plan of support. And that's how it works around that person. It's not block contracts, which might be familiar to some people. And then, yeah, as I said, it's a very flat management structure. And this is the kind of work that we've done across the country, in different parts of the country, supporting new organizations to grow with those foundations so that they can offer that kind of support. What does it mean to people? Well, Huey, love Huey, met him about 4 years ago and interviewed him as part of the work that EASPD funded. Huey was supported to move out to Inclusion Glasgow about 24 years ago. And when he moved out, he had a lot of support. Life was really complicated. He was very clear about that. But now he sees a support worker for an hour on a Friday afternoon for a cup of tea because he lives with his girlfriend and he's happy. And that's the kind of difference. Small supports work on, it's the least support you need. And if you don't need support, we're not going to keep it in place. It's not about building up numbers. It's not about charging huge fees for large teams. If you don't need the support, then we're not going to, it won't be there. For Mark, you heard about Mark. Mark had been in an institution for 20 years. He was supported to move out about 2 years ago. He moved out with quite a lot of support. That's not in place now, and I know that it's reducing in the last couple of months. Things have got even better for Mark. He's got his own home. He's a volunteer. He works in a local gardens, and he's teaching his team to magnet fish, which looks pretty cool. So we have a small supports in Leeds called Unique Support Solutions that doesn't just offer support, but it offers magnet fishing as well. I'm not going to explain. You can watch the video, and Mark shows very clearly what magnet fishing is if you don't know. In his words, he's living his best life. For Dean had a really traumatic childhood. Ended up in and out of placements. He's quite a young lad in his very early 20s, and has a lot of support needs, which is why most of his placements broke down, but he ended up living on the streets in Bradford. His dream, it was that he wanted to see wind turbines. His life revolves around wind turbines, and he now can see from his back window or his bedroom window with the help of a telescope the wind turbines on the moor out the back of his house. Now that might sound, to anybody else who isn't into wind turbines, it seems a bit daft. But this is the idea that somebody's voice and somebody's dream is their voice and it's their dream, and that's what we do. So if it's about watching wind turbines, and he went away on holiday for a few days, first ever time on holiday, and it was a tour of wind farms in North Yorkshire. But for him, that was heaven. And I think it's that thing about actually listening to what people say. I think the other side of this is it's always really important. It's never the easiest of conversations to include money and finance, but we have to be sure, have to be clear about how money is being used. It's the public purse. We've done there's a link on the bottom of this slide to a report that explains things in detail and actually it includes 9 stories from 9 people who are involved in this piece of work. It's their own words or the words of their loved ones that describe their experience of being in institutions and their experience of life now. We measured their well-being. We looked at the change or looked at the improvement and put a financial value on that. So that's probably £750,000. That's well over 800,000 euros. And what we mean by that is it's the lack of other services that they need now that they're happier. If your well-being's going up, then you're a happier person. You're not going to be needing all the kind of supports that you needed when you were unhappy. There's been a reduction in support costs. That's the difference between the cost of an institution and the cost of being supported in the community. There are differences between the UK, and I'm aware because I spend so much time talking with Andrea and her team, between the costs of institutionalization in other countries in Europe. But still, in the long term, especially if you look at the other economic values that we're talking about, there's going to be actually, I don't think the difference is as big as that, although the proportion might seem like that. And the last one that we mention is the number of incidents, because people have been in situations where there were huge numbers of incidents in their life, and that those incidents have required police, medics, ambulances, and that's a big cost. But if the incidences reduce, for one guy, it was from 136 incidents a year down to 1 a year. Then if we're seeing that level of reduction in incidents and that level of reduction in demand on different agencies, then that equates, for 6 people of this 9, that equated to nearly €1 million. So, and that's per year. So that's what I mean. I think it's not just looking at the cost of support, it's understanding, and this really simple phrase, if you do the right thing by people, if you listen to them and give them their voice and understand that and don't compromise on it, then actually the ripple effects of that are absolutely huge, because people are happier, they need less support, they need less interventions, they need less emergency help, and actually things work in a much better way. The very last slide I've got, I hope I haven't overgone my time. I practiced 3 times this morning to try and make sure I'd stick to time. It's just often I hear from different people, well, institutions, some people will always be in an institution, and I think I fundamentally disagree with that. And I fundamentally disagree with that because I see every time I work alongside small supports, I see that it's just not true. Everybody has a chance to live in the community, and this is how you put the support in place. So thank you very much.
Thank you, Nick. You were perfect in time. So thank you for that. But I'd also like to say thank you to Andrea for sharing insights on what small support is. What I've taken away is voice is very important, relationships and connections and home. And you painted out the evidence is very clear for us. So I think that helps us go into our main discussion beautifully. So can I hand back over to you, Stephen?
Thank you, Ken, Clinton, and I'm also very happy because we'll be asking, first of all, our panelists to come in on this discussion, and then we really want to open it up to everyone else who is here. And I'd really echo your thoughts, Clinton. It was so good to hear not just about the principles of small supports, but also its history, how it's built up around individuals who have made that successful transition. And also to hear from Andrea that often it's people with the highest support needs who get left behind. I think those were really important messages that I heard, and how small supports has a potential role, I guess, in unlocking these really complex processes of deinstitutionalization. And so now I'd like to bring in our panelists. You've heard a little bit about small supports. We've begun thinking about it as having a possible role in deinstitutionalization. So what for you stands out about small supports from your particular perspectives? And I'll ask each of our panelists first to come in before then inviting everyone else who's joining us today. Would it be possible, Alexis, for me to come to you first on this question? What did you take from this around small supports? Thank you.
Yeah, thank you. I mean, I think for me, there's a narrative that gets built up, a dangerousness narrative that gets built up around disabled people. That certainly was my case. People saw me as somebody that was different, that was other, that was violent, that was aggressive. And I was in settings that brought out the worst in me, so disconnected from my family and from my friends. And I didn't have that sense of belonging that Clinton talked about earlier in the session. So for me, I think what small supports does is it alters that narrative. It shifts that narrative, because it isn't about moving me or people like me into other settings that are a bit more in the community. It's saying that we have that equal right to living in the community and to being a part of it. When I was in institutions, the best some clinicians hoped for was that I would live in a residential supported living setting, and I'm in my own home at the moment. So it just shows what's possible when we reimagine and we change the narrative around people.
Alexis, thank you so much. I think it's super clear, and when you said it's not about moving me, that really, I think, resonates with me. And I think often we see that processes of DI, if I can call it for that for short, they seem like these really technical processes, but they're about moving numbers of people from here to there, as opposed to, as you say, looking at what's our place in the community. What does that actually look like and mean? And just congratulations on taking that control back, Alexis, to you, and for sharing that with everyone else. I bring in Ines, if I may, at this point. Ines, small supports, making that transition. What do you take from this around what it means for DI?
Yeah, well, I really like small supports. Shall I start with that? I think what's important is what is great about it is it approaches each individual, on their own, in their own right, recognizing that each person, is completely different. It's not just in terms of what support needs they have or the level of their support needs, but also people are different at different stages in life. They want different things. They like different things. I mean, they might, we are all different. And I think it's kind of it's the very opposite of what we see how actually governments want to do deinstitutionalization. They want to do everything at once to find one solution for every, one solution that everybody has to fit into. Like, we will do this, we will, often, yes, put people into groups, into homes. We will try to match them as, best as we can. And it's the very opposite of approaching each person individually. And I think also what this kind of wanting to do everything at once, wanting to cover as many people at once, also leads them, to this idea that it's just too difficult to to have some people live in the community, because they just see this, big group of people with, I don't know, very, complex needs, and some people who have lived in institutions for a very long time as well, have never lived in the community, and they just don't even think about them as, one of us or as individual people. So I think the small supports kind of breaks that, breaks down that narrative or that view, and it'd be really important to get people who do make decisions and who can, who with their decisions can influence people's lives and can do something, either if they adopted this approach where they did look at people as individuals with their own stories and wishes, and try to respect their decisions, but also empower them and really support them to live in the community. So I think there is one. I think what I see as a difficulty a little bit also with small support, how to also get those decision makers, let's say, to not try to change small supports and to apply them also as some sort of one size fits all solution. I think that it's very hard to break down those just to change people's mindsets, that they don't also see, okay, now we're going to introduce hundreds of small supports organizations at once in every village in the country, and then they could mess it up again. Because they can, we know that they can sort of mess every good thing up. So it'd be important to show that, I mean, this small supports really have to be done as small supports in a very individual way. And it's great to see also, although we don't like to talk about money, we don't think it's, it's fair to measure how much somebody costs or doesn't cost, but it is good for policymakers, that it's good to see those also economic arguments that we can show that we can use, and that it also, so just to counter that argument that there is no money and that it costs too much. So it's very good to have that. I'll stop here.
Thank you so much, Ines. I also saw Alexis sort of nodding along at various points, and you both spoke really clearly about the narrative shift that small supports can create. So it's changing the way we think about what is a good life and how do we support people, away from what you were pointing to, Ines, which is like a one-size-fits-all model. Let's now have a national small support service with branches across the nation, which Nick, I'm sure, would just fall off his chair. So kind of, I'm managing that as an understanding that that's needed because of the diversity of people, the people's lives and experiences and the types of support they might need. But it was interesting also you reflecting there on some of the economic argument. Maybe we'll come to Milan and Thomas in a minute. I'd be very interested in your thoughts on that economic component as well. But maybe, Milan, if I could bring you in, because you've been so directly involved in getting people out of institutions, shutting institutions, and advocating for support. So kind of what do you see in this model of small supports? Is it useful, or does it replicate well in your experience in other contexts?
Yeah, I think the last part of it is the important question. I mean, we can all obviously, I guess, partly invited here because we like small supports, and I don't think we need to waste much time praising the model. I mean, I've interviewed Nick about this a couple of weeks ago. Obviously like the approach, but I think that is the question. At the same time, as Ines was saying, as other speakers said, of course, it is important to protect the core, the values and the practices and the principles of supporting people the way small supports do, which is each one individual as that particular human being with their own interests and qualities and whatever needs they have. That is the essence of support. The quick challenge of the main challenge to this is how do you do that for the 1.5 million people in institutions, because that is the number of people in institutions in Europe. And so if we want the change to happen for them as far as possible, so that their lives are not wasted away on those segregated places, we, I think, should be spending most of our energy figuring out how do we use the best of these models, or how do we protect them to the best way possible, or also how do we make them available to the biggest number of people possible. And I was thinking these exact things and asking the same question just this week. I spent most of this week in Romania among people who got out of institutions, who spend a lot of years in institutions, and those who are supporting them. I think the way they work there has a lot in common with small supports operations, let's say, or the operating principles. And as much as I like everything about what they are doing, it's not criticism of them. It's just getting back to the question. They got 6 people out of institutions, and Romania has 16,000 people of institutions. So I was asking them, and I'm constantly asking this question of myself and everybody else, trying to figure that out. How do we make the change happen for everyone? At least 800,000 people with intellectual disabilities of the 1.5 million people with disabilities overall in Europe. And how do we do it in a way that protects the core values? And I think, I'll stop here, but I think a very important part of this is to a little bit redirect the focus from 2 things that are often very much discussed. And one is the housing, and that is obvious and important, and everyone shouldn't eat up all of the time that goes into thinking about the institutionalization. The other often is, let's say, the household management skills, how do people manage with cooking, cleaning, hygiene, all of these things, to the attention to how does a person function in a society. How do they build new relationships? How do they build new social roles? All the things that they didn't have in an institutions, all the things that that institutionalization took away from them. And I see that as that being of the least focus on all the institutes, not all of them, but majority, of course, generalizing from my point of view of all a lot of the institutionalization conversation. So conclusion, I very much like in the podcast I did with Nick, I didn't hear him use the word today, the small supports and the word joy for people in supporting people. And that is an essential thing of this approach. I'd say the humanity of it. And you can use the word joy. I'm not sure a lot of the policies and policy making is very good of handling words such as joy. And that to me was one of the most interesting aspects of the conversation and the work with small supports. Thank you.
Thank you, Milan. And I just think you've really hit the nail on the head. How do we kind of ensure we protect the principles of small supports, whilst recognizing the huge numbers of people affected, and that we really do need to find ways of kind of unblocking this sort of transition, and actually to zoom back in to that principle itself of relationship. You both have pointed, and all of us, I think, that DI isn't about moving people or just ensuring personal hygiene or care in the community, if I can call it that, services in the home. It's about that re-establishment in the community, that really important aspect of being in relationship. And just to push back, because similarly to Ines, I was going, oh, economic argument, but to push back, of course, it's not just what we save in respect of providing this support to people in the community, but it's also what those people contribute to our communities. And that's the other side of the economic equation, which I've not yet seen addressed. Now, Thomas, you've got a hard task here because you heard all of this to come in, but of course you are working with service providers for people with disabilities and representing actually many across Europe. You've heard the scale of the challenge, but also a lot here about small supports, which we're talking about today. What do you take from this model, or what do you see as the opportunities actually in informing better DI processes?
Thank you very much, Stephen. I'm sorry, I'm just recovering from a cold, so my voice is maybe a little bit, so sorry, my apologies for that. Yes, I also really like this model. I met Nick and Bill and others in Denmark, I think a few months ago, and it shows a lot of promises, but I'll try and get to why I particularly like it. So EASPD is, on the one hand, a network of service providers, but I would also like that it's a network of service providers with quite a clear mission, which is to transform radically the way that we do things, away from the medicalized approach towards those that are in line with human rights. And I think our experience as a whole, and I'm sure for many of you too, there's a lot of stagnation going around. And that's obviously very frustrating. So we're looking at, why is that stagnation happening, and what sort of levers do we need to change to really unblock it? And we look at societal level blockers around ableism, around the community. We look at policy related measures, for example, around personal budgets, public procurement, like what are the right funding models. We also look at what service providers have to do themselves and their responsibilities. And on the one hand, it's transforming the way that you provide support towards person-centered, community-based services. But an area which often goes lacking, but is key, and I think it's where small supports really comes in, is the organizational model behind the support services. In this case, the localized, the small approach, and how that can impact things. So when we're looking at the organizational model behind that they can deliver on this small community, locally rooted, partnership-based, relationship-based types of services, what is the role of leadership in there? And I think small supports highlights it well. I think, at least with clarity, that the person who works for a small support team should know everyone who is supported. That brings, I think, clarity to that. There's also the question of finances and how you make the most of the finances. I think a lot of service providers, they often have rigidity in their financial systems, so they're paid to do one specific thing, and therefore how can they do something different if they're not going to get paid for it to a certain extent? So that's something that is problematic. But the personal budgets system in the UK, although can and should be improved, brings a lot of flexibility to service providers to be able to do that. I do see supports, small supports as a service provider, although of course I'm not trying to mix up the good and the bad. Human resources, again, how do you go from a more top-down approach that traditional service providers has, which is in particular to protect risk, to reduce risk, a very top-down bureaucratic message. How do you change that around? Locally empowered, really, a person with a disability says, I want to do this, and the support worker can say, okay, and I'm supported by my employer to allow myself to do that. Again, the small support system really turns it around, and that's really fantastic. And then there's other elements to it too. But all these points, I think small supports, it really fits in well in these types of questions, and also brings, I think, very adequate solutions to it. Another point is that I think what I like about it is that it challenges the status quo of the service providers, and it's forcing me in my role also to think differently. Do they have a point, and to which extent do they have a point about, for example, being small? Locally rooted, yes, everyone, I mean, there's an agreement around that, but specifically the small size, and I'm not sure we have the answers to that. I think you can also be a larger service provider and still operate in small teams. But I think there's room for discussion around that. I see the argument. I'm not yet 100% sure about the answer to that, to which extent it's true. But certainly they're asking the right questions. And then there's other questions around, because we're in a European conference here, to which extent can this model work in different countries, in different regions, in different towns? And to which extent can it do that without changing? So the previous speaker said it should not change, it should stay within its current system. But that will hit the barriers of the communities and the, let's say, the rigidity of the policy systems that exist in those countries. And so, you want to scale it up, you want to make the most of it. But then, if you're not changing, it doesn't. But to which extent you should keep what matters, and maybe some elements maybe are adaptable. I don't know. Maybe there could be question marks around that, or maybe not. But I think that's interesting. And then the last point is around personal budgets. The UK has personal budgets, but most European countries don't have it, or at least largely. And therefore, basically, I don't think the system works without that type of funding system. Maybe not, but yeah. But again, really, really great. I love that it challenges the status quo, challenges myself. I have already put it on the agenda for discussions with my board as well. Yeah, really great. I think there's just a few more questions to answer, in particular about how you scale it out without taking away its strengths. Yeah, thank you.
Thank you so much, Thomas, and so good to hear that this is about like challenging that status quo. And I think I agree that it's a really useful tool of reflection when we're thinking about policy, service design, advocacy, and budgeting. These are all points that you've identified are barriers, and I can see Andrea here, the kind of a little bit nodding, because perhaps these are some of the barriers we might see in Slovenia and which we can work to overcome. But at this stage, we have about 10 more minutes. I'd like to invite anyone who would want to come in from the floor. All you need to do is raise your hand, or just unmute yourself. If everyone starts talking, then I might direct. But would anyone like to come in from the floor to give any thoughts or reflections you have at this point? I just give a minute. And also I see there's been a lot of chat in the chat box as well. Maybe I pick on people. No, I won't be so terrible. But Nick, please feel free to come in, because Nick, of course, you've heard a little bit of both the good and the critique.
Yeah, I mean, I think there's something about and the people's concern about when you scale up or when you introduce it, and this is kind of like when governments get hold of a good idea, it always goes a bit pear-shaped, and I would agree with that most times. So there is something about how's it taken forward. I think there's something about Alexis and others have used the word human. I would put that alongside the word joy. I'm going to kick myself forever for that, for Milan not using the word joy, but there's something about how do you keep the human scale and those sorts of things. Whether it's a big organization running different teams, I'm kind of less worried about, although I do worry about the fact that the director probably doesn't know everybody that they're supporting, because the moment you lose, I mean, easy example, I was with Andrea and the IRSSV team 2 weeks ago, and we went to meet a support provider, and everybody was in the room from the support provider, pretty much. Not all their PAs, because they were out supporting people, but the people they support in supported living were there, and the team, and everybody knew each other, and the vibe was fantastic. And they were talking about their ambitions, and it was like, oh, don't lose this bit. This bit's the bit that makes sense, because everybody was there as a community, and it was a really powerful thing. So it's, as much as there's a fear about losing things, it's actually, let's focus on what we must not lose. And that togetherness is the bit, and it's all about human connection. I think that's what makes the difference for each of the people I know who have supported. Long conversation with Alexis yesterday, and a good friend, and there was something about human being, the human scale of things being really important.
Thank you so much, Nick. And of course, it very much resonates with those core principles that you started out with, and how they can actually promote some action on the ground, actually. So people feel those values in practice when they're being utilized, and how important and special that is. You name-checked Alexis, and so I might come back to you, Alexis, if I might, because you kind of heard other people's perspectives here on what does it mean, right? Moving people or supporting people to move when they've been in institutions, but so that they can actually live independently and support. Kind of what do you hear are the challenges, or what would you like to share from your side, based on what you've heard already from the others on the panel?
Yeah, thanks, Stephen. I was really struck by Milan's comment when he was talking about the relationship aspect, and that's like less thought about. And I remember when I moved back into a home setting, just being able to go to the toilet when I wanted to, be able to pick my clothes, be able to plug in a phone, be able to use those things, just that connection, just to everyday basics that's just kind of taken for granted, and that can be quite shocking. And also just having greater longevity of relationships, or the opportunities for those, and having to build up things like trust and confidence in other people, and sitting with the fear, I think, that at any point I could be sent back. If something goes wrong, that anxiety, that if I did get overwhelmed, or I did have a meltdown, or something did happen, that fear of being sent back. So I think there's lots of tangible things presented today that we can talk about, and which obviously need to be thought about. But there's also that relational security. Predictability isn't always about structure and routine and getting the physicality of things right. It's also about how safe people feel, and that really does determine the success of small supports.
Thank you so much, Alexis. It really strikes me, and Milan has mentioned this, and Nick also, but in this model, or at least I shouldn't really call it a model, but this type of approach, it's about not walking away. So ensuring that relational security, I think you called it, Alexis. I think this is a really important insight for us to take forward with this discussion. And I see, Ines, you'd like to also come back in, so please do.
Yeah, I have more of a question, Stephen. I was just thinking that over the years, I have come across organizations in different European countries who would match, let's say, a description of a small supports, organization. But they were sort of very much on their own, and they would burn down, they would lose funding eventually, just give up, because it wasn't sustainable, and the many of these programs, good individualized supports, unfortunately don't last for a long time because of that. So I was just wondering, how do you get the support, and how the small supports in the UK or in England, how sort of what guarantee there is from whoever is providing funding that they will continue funding this. So it needs some kind of buy-in from the government or from the local authorities, whoever is funding it. So I was just wondering how, because it wasn't really explained, how do you go about that?
Thank you, Ines. Kind of talking about that sustainability. I see Thomas wants to come in. So I'd like to bring Thomas. I'd like to bring in Nick. And there is also one question I'd like to bring in from the chat box. So I'd ask you like a minute or two each, just so we can stay on time. Thomas, could I give the floor to you first?
I'd be far less than a minute.
Okay.
So although I was born in the UK, I've actually lived and worked most of my life outside. So I might sound like I should know this answer, but I don't. How does it work with the licensing systems when you develop a small support system? In many countries, you have a licensing procedure. How does that operate in the UK?
Okay. Super. Thank you, Thomas. And so, Nick, we have two kind of questions there: the sustainability of funding part, the licensing. I don't know if you can say a word or two about that.
Yeah. I mean, in terms of licensing, it's a registration. So they're all registered for, there's something called a legal due, a regulated activity, and the regulated activity is the delivery of personal care. All our small supports are registered to deliver personal care, to deliver the regulated activity. So they're regulated with our national care, the CQC, Care Quality Council Commission. I know it as CQC, and I suddenly thought, oh no, what do they stand for?
Commission,
Don't laugh too much, Clinton. So so basically, and that's an insistent, but it makes really good sense, because that means there's a quality of practice that I mean, there's obviously going to be a debate about how much a national care inspectorate can identify real quality on a personal level, but it means that there's a standard of practice. I think that's the key thing. So they're all registered with that to deliver the regulated activity, which is personal care. The funding is individual. There's a duty of care. There's a duty to fund the support that people need, and that funding is not going to be taken away. The funding for each of the individuals who are supported by small supports is either local authority or municipality, or health service. Health service tends to be more not just a municipality scale, a regional scale, for as a way of comparing outside of England. Sometimes it's a combination of both. We actually we've got one young man. I mean, this is the numbers, but we've got one young man who's supported by education, health and social care in one small support, which is the first to get education money, because often that's tied to schools. And in this case, it's not anymore. So that's a brilliant outcome for this young man. So the funding comes individually. It's individually allocated, mainly because for this group of folk that we're thinking about, you can't standardize a level of funding for a person. They'll need a very individual package of support. Small supports do work on the least support necessary. Often you'll get psychiatrists in hospitals recommending ridiculous staffing ratios of 6:1 or anything, but that's mainly because they don't understand how life is in the community, and they choose to forget that institutions are an intensely traumatizing and distressing place to be, and often your support needs are greater in an institution than they are when they're actually back out at home. I love the moniker that comes from or the saying that I got from the guys in Trieste. It's like, you'll never get better. You don't get better in hospital. You get better when you're at home, and I think that's very true, and it's certainly very true for the small supports world. So I think it's I think the funding is individualized. It's a combination of municipality and health. And in some ways, because people have been placed in a psychiatric institution, it means they've had a section, or they've been deemed to need that level of support. And because of that, there's a duty to provide aftercare funding as well in the UK. And that's a combination of health and municipality funding. So it's all individually allocated because of the high level of need that the person has.
Thank you so much, Nick. And I realize there's a ton of other questions that we could go into. What we're going to do, I just want to summarize, because I saw some very specific questions that I think we can come back to later this session. One is about peer support as part of small supports. One is about the legal capacity, the right to legal capacity. So I think we will have actually time to come back to this. At this point, I just draw this particular session to a close, because I want to hand back over to Clinton, because what we're going to do is we're actually going to think about, is this going to work in Slovenia? So Clinton, can you take us through it?
Thank you very much to all the panel. I just a closing reflection on what I've heard, and I just wanted to get it out there before I forget. Scaling small support isn't about making small things bigger. It's about making big systems smaller, kinder, and closer to the people they serve. And I think from all of us on the call, we should have a shared commitment to keep small support human, relational, rights-based, and ensuring the growth never comes at the cost of dignity or joy. I just needed to say that, and I just want to thank all the panelists. That was really, really rich conversation, and thank you for facilitating that part, Stephen. Our next part is about case study, and we're gonna a case study from Slovenia, and Yusuf is gonna present. So Yusuf, if you can introduce and present, please. Thank you.
Yeah, thank you. Thank you, Clinton. Yeah, I'm Juš, and I work at the Social Protection Institute in Slovenia. I will not present, as you know, we don't have small supports in Slovenia yet. So it's really about maybe going a bit deeper about what Andrea has presented already. So this is the, so let us talk about the potential of developing small supports in Slovenia. So a bit about the national service context. So we have psychiatric hospitals for relatively short-term care, and then all the residential long-term care is in social care, in social sector in Slovenia. So we have really long stays in these institutions, and those have both open and secure units, so locked. And so people come in locked units in major part involuntarily, according to the Mental Health Act, and we did a small piece of research about secure units, and we knew how bad it was, but until we had these numbers and stories, we were just blown away by the fact how the situation is bad. So basically we have the mean length of stay more than 5 years. There are 17% of discharges per year, and when they happen, they mainly happen to open units of the same institution, the secure units are mostly in quite bad state, let's say, and so when we were trying to see, okay, this is secure units are for adults, but then in last few years there have been 2 pilot projects about specialized units for children and adolescents with learning disabilities, and let's call it, I really don't like the term, but let's call it challenging behavior. So all the children and adolescents who require more intense care are now there. And so those units have more or less the same core characteristics as secure units in for adults. So basically, so we have this situation on one hand, and then on the other hand we have our competent ministry adopted strategy for DI in social care 1 year ago, and there have been 2 pilot projects of deinstitutionalization in from 2020 to 2023, and a long history of DI really. But the core issue of the whole process until now was a challenge of how to move people with the most complex support needs. And so we gained one very important lesson from one of the institutions which said, okay, we will start with the most easy people, yeah. And we just wanted to say no, let's do it other way around. But so now in both institutions, the core issue is now, whoa, now we have people in institutions, in those two institutions who have more complex support needs. And then this is the real, I mean, the challenge, very concrete challenge right now. But of course, we also have some NGOs who have done some really great work in individual resettlements. So they provide really person-centered support for individuals, not in group homes. So basically, to wrap it up, I see these next steps as twofold. On one hand, I see that the small supports model can inform the practice of local NGOs. They may not adopt it in total, but they might say, they might pick it up, this idea of staying small, staying local. I think we have in our country right now some NGOs who do not want to grow. And then on the other hand, we really have this idea of doing a pilot project or something like that, which would enable to support somebody move out of a secure unit or the specialized unit for children and adolescents or somewhere else. So to start really with people with complex support needs, and so this second idea is to really adopt small supports model in its whole. Yeah. So yeah, this is shortly about it. Thank you.
Thank you very much for setting some of the challenges and progressions within Slovenia. What I would take from that as when a country wants to move people out of institutions, change can get stuck, but because of old structures, but also how the funding systems that can create or and the habits will remain. So it would be interesting. You mentioned about NGOs and their role in playing in that to harness small support. So I think what I'm picking up, there is possibility and hope around to move into that space. Yeah, would you agree on that?
Yeah, I mean, I think we are now having lots of hope, but now we have to transform it into some really concrete, basically concrete actions. Yeah, and plans. Yeah, you know, I think one of the biggest issues is how to assure funding, which can be in moving somebody with more complex support needs. It might take a bit more of money for a certain period of time. So I think this is like we have to solve some concrete issues, but I think, yeah, we have to plan concrete steps. Yes.
Thank you for sharing your thoughts and insights and on that. Can I hand back over to Stephen for the breakout group?
Yeah, you definitely can, Clinton, because thank you so much. It's so interesting to hear about and very interesting. How do we prevent that gap, right? The gap when people leave an institution to when they're in the community and they need that support ready to go, right? And I remember hearing for many years about the personal assistance scheme in Slovenia not starting until you get out of the institution, which means it's hard to even prepare for that transition. So really, I know there are many, many challenges, but lots of opportunities. And perhaps small supports is one of the methods that can support in making that. So now we have, you've heard enough from all of us. It's now an opportunity to hear from everyone and all of you. The next part of this session for about 15 minutes, our lovely colleagues here, Kaya and Rebecca, I know, are about to split us up into breakout groups. So we'll be in groups of, I'm not quite sure how many, but up to 10 or 15 people in a group to have a bit of a discussion. And we've prepared a question for that. The question, I'm putting it in the chat box, is a simple one, maybe, but maybe not. What does it take to drive a DI agenda that is person-centered, local, and high quality in your area, country, or community? There's no great good answers, but we're really encouraging people to think now into their own contexts. Welcome back, everyone. It's always incredibly jarring, that move from breakout groups, I know, back in. But I really hope the time was well spent together. Certainly in our group, we had a really good discussion with all of the participants. We have about 15 minutes to feed back and have a bit of a discussion. So I'd like to invite the facilitators of each group, one at a time, to just share some of those thoughts. I facilitated a group, so I'm happy to start. What would help me is if the other facilitators could put their hands up.
Okay.
And maybe your virtual hand, so I don't forget, if you don't mind. But do shout out. I'm happy to share, though, from my group, we had a great discussion with Julia, Angelos, Anya and Marta. We covered the situations in Croatia, in Slovenia, in Poland, and also Greece, and a little bit in Italy. And let me just say that we talked about how central advocacy is, giving voice, let's say, to Nick's point in the process of DI. That was particularly the point in Croatia, coming out really strongly. And in Greece, there was a real discussion about how do we get not just the people prepared to live in the communities, but the communities prepared to be inclusive. So what is that pre-work to create relationships that need to happen? We spoke also in Slovenia how the change in law is going to provide a real opportunity, hopefully, for social work to go back to its roots, promoting connection in the community. So that was the message that was coming through. And finally, in Poland, we were talking about the role both of public opinion as a barrier, potentially, to inclusion in the community. So we need to work on that. But also the centrality of home and the housing first model, which was shared as part of advocating for DI. So I've tried to cover some of the parts we have discussed in our group. Now it would be great to hear from the others. Yush, you have your hand up.
Yeah, thank you. Just a short summary. So somebody was talking about changing hearts and minds. So about this culture change, which must happen for small supports to be really effective. Then providing people independent housing, so giving people roots, and ensure that this housing is really not conditioned by service provision and so on. And then also recruitment processes and who we are recruiting. So basically, we would like to see recruiting people who like people. And yeah, that would be it.
Thank you, Rush. Yes, Let's have people who like people doing this job. I think that's a pretty good starting point. Kaya, I hand the floor to you for about a minute.
Yeah, we were a small group with Radoslav and Ines. And we spoke that it's really important to have a strong voice of people with disabilities, survivors, and their families, more like they're as a watchdogs of the process of DI. That they're very activistic in their role, and to remember all the key stakeholders on national level or European level, how the DI process should continue, and to drive the DI agenda. But also that it's important to have on a national structure, one structure that is not changing, even if there are some changes in the government or other outside changes that can support the DI process. So there's a stable structure to always continue with the DI process and to support it. That's it.
Wow, you've solved it. No, it sounds really very, very fruitful though, really important there, that DI processes are sustainable beyond just one government to the next. Bill, what did your group pick up on?
We were a small group too, but we think we kind of think we made up for it in quality. I guess the core thing that we were reflecting is that deinstitutionalization now is so often driven by scandal. It's driven by scandal, it's driven by abuse, it's degradation and a destruction of people's human rights. And for things to really change, we actually think it needs to be driven by storytelling. But when we talked about stories, we weren't just talking about beautiful stories, though all the stories are beautiful. We were talking about stories that actually talked about how amazing new things had been set up, stories that showed how somebody's life was different, stories that talked about how we made the money work, and stories that talked about human rights. So I think our core point is deinstitutionalization needs to be driven by rights, not scandals.
Thank you so much. So clear, and also how important to support that narrative shift as well, I think. Andrea, please.
Yeah. Okay. Yeah. So I think we also were a group of 5 with Clinton, Isabel, and 2 Polonas. We actually started from very direct practical things, and then we went more on like what are the other settings, more policy oriented, that need to be there to develop small supports. But we started with this, that it's what should we do in order, we're discussing about what to do, how to support people with complex lives. And the first thing we said, what's the most important thing is to know their life story, to get to know them, and then we can start helping them and support them. We need to know in which areas they need support, and we really need to listen to people. That's quite important, and then go towards that way. Then we went on the topic, of course, of deinstitutionalization and how it's a widespread European issue and really big problem, and how in every country we're pushing for a plan for DI, and particularly for people, and that it's harder to leave institutions for people with complex lives and who need more support. But also with that, when we were discussing that it's not, when resettling people with complex lives, it's not only about supporting the person, but it's also about supporting the environment, the parents, the community, and so on and on. And then our last topic, and also we discussed a bit also about regulations, how on one hand we want less regulation if we move towards small supports in the community, but on the other hand we want more regulation regarding quality of services and quality of life and so on and on, because there's so many regulations about stupid things in place in social care, but nobody really measures the quality of a service or how a person feels in their own home, and so on and on. And then we finished with the very inspiring speech from Clinton about how we need really a social transformation and how institutions isolate and communities connect people, and how deinstitutionalization and small supports is about right and justice, and that safety without freedom it actually means containment. It's not really safety, and that we really need to stop discussing about money, how there's not enough money to support people with disabilities, because it's what we really actually need. Instead of discussing about this shortage of money, is about how we can develop or support local leadership and invest more in the communities that will be able to support people with very complex lives. So that was it.
Thank you so much, Andrea. It sounds incredibly rich discussion. Clinton is both inspiring and will be shortly telling me off for going over time, I hope. But I'd like to give the floor, if I may, to the two other hands, and then I'll hand over to you, Clinton, for the next part. So Katarina, can I give it to you for a minute?
Yes, so I was actually in a room just with Milan Șerepa from Inclusion Europe, and which was good because we could take time to go more in detail what is the DI process in Slovenia at the time, in this moment, what's going on. And we've started actually thinking more about how can Inclusion Europe or Milan or other people that we meet support this process in Slovenia. So we went maybe a little bit more into already action plan and discussing how to organize sharing experiences with countries that are in similar process, and what works for them, what works for us, and how to do this all connections. So this was the main focus of our conversation.
Fantastic. I love the action orientation, Katarina. And finally, Nikki, I give you the floor.
So we were also a small group and had quite a broad range of conversations, including a lot of things that had already been covered by people. But we also drew on things like getting political support for change to happen, as well as thinking about some of those organisational things that need to happen. And we also talked about, if we're looking at deinstitutionalisation, then really we need to be looking to those children that have been born now and that are children in education now, and ensuring that children with disabilities and with additional support needs are visible and within our schools and within our education systems, that the families are getting the support that they need. We talked about workforce and having the right people with the right vision for people and the right values for people to be living really full and ordinary lives, and that includes things like having families of their own, and that having those staff and that workforce that would include ensuring that social workers and systems supported people with disabilities having children, and there wasn't an automatic referral into safeguarding or children's services when a person with additional needs has a child. And so really looking at that whole system change as part of this deinstitutionalization and not just moving from a building to a home in the community. And finally, we touched on actually we should be really focused on people living lives that are really happy lives, and that people have lives that they are happy with, and that means something to them.
Thank you so much, Nikki. Meaningful lives, happy lives, inclusion and relationship. I think it was also so great to hear your reference to education and the lifelong planning that we need to be doing here. So thank you so much. I see Nick has his hand.
I'm
He's
going to
the
feel
boss.
really real technophobe here. I can't work out how to put my hand up on the screen. So it's like,
Please.
really, really simple. We had a very small group. We talked about the challenges of politicians who keep changing their minds, and we shared experiences of that. But the key one actually was the importance of having hope and being part and linked up with people in this case in other countries who might be encountering the same problems, but maybe having a bit more success, and kept you feeling hopeful about the potential of being able to do something. Because if you didn't have that, then you'd be really stuck on your own. So we talked, and that was the key uniting thing, that what's it going to take? It's going to have working together with other people.
Absolutely. Solidarity as well, Nick. I'd ask all of the facilitators to share your short notes with Nick, because I know Nick is going to make and the team will make a short report for everyone, but it sounds incredibly rich. So if you don't mind, it would be great to do that. Clinton, with my great apologies, you can tell me off afterwards. I hand back over to you because I know we're a little bit behind time now.
Yeah, thank you for that and that rich feedback from all the facilitators. I don't think we have time to ask the panel some reflection, so I apologise for that. I think we're best to go into the summary and closing of the event and keep on time for that. So I'd like to thank all contributors and reinforce 3 key messages I think has come. The first is institutions are not community. Number 2 would be about segregation is not safety. And the third point would be small supports are not luxuries, they are rights. And if we can remind people about that, and the biggest thing that I'm taking, this is about people's lives. And in England, we have the phrase called gloriously ordinary lives, and everybody wants to live that, and especially me as a disabled person, I want that more than anything that most people take for granted. So I'd like to invite Stephen to offer a brief, your reflections.
Do you know, it's hard to go after you, Clinton, because gloriously ordinary lives, I might have to ask your permission to use this elsewhere. But let me also just say, professionally, this has been very inspiring. And also I know many of you in your incredible work over the years. So I look forward very much to enhancing those connections across borders. But I will also say, personally, fighting in my family, in my own life, for support for family members in the community is exactly about this. Relational, really about providing more than just the basics, but really about inclusion. It just makes me feel well supported by all of you, to know that there is a community out there developing real solutions that help real people and is not as complex as all of what some people have us believe. So thank you, Clinton, so much for your support today. And thank you to all of our speakers as well. It's been really incredible to listen to all of you.